I have doubts about the bill. I do not think it is a step toward anything I've supported in the past. However, after careful discussions with President Obama, Speaker Pelosi, my wife Elizabeth, and close friends, I've decided to cast a vote in favor of the legislation.
That's one for Obama and Pelosi. They're going to need a few more of those no votes switching to yeses to get this bill passed.
And this may be the first and last time we start the show with Dennis Kucinich. Top Line starts right now.
Hello and welcome to ABCNews.com's Top Line. I'm David Chalian.
And I'm Rick Klein.
Each weekday, we're bringing you the very latest political reporting, insight, headlines, analysis, everything you need and want to know about politics.
And it's twitter.com/thenote. Stay connected all day long. Answer our question of the day. Let us know what you think on all the topics, large and small.
Crunch time, sir. Get us started. What's your top line?
Switch in time, but do they have 9? See what I did there? Dennis Kucinich becomes the first no vote to go. Previously on healthcare, he was a no. He's going to the yes column. All the other potential switchers, though, this is where it gets tough. The other ones are moderate to conservative Democrats. They're from those swing districts that it's going to be difficult. They're going to have to build this up one at a time to get to 216. Probably in the neighborhood of 10 votes are going to have to flip. But you got to start somewhere, and they're starting with Dennis Kucinich.
Your point about the rest of them is key. It didn't look so easy to get Dennis Kucinich, and President Obama got 59% of the vote in his district, and Dennis Kucinich is not really challenged in a big way for re-election. So it's only getting tougher from here on out. Sly as a fox. Yes, President Obama sitting down for a rare Fox News interview today, and it is exactly because of those moderate districts that he's doing this interview, Rick. He wants to get in front of those more conservative audiences in a lot of these McCain districts, and I would imagine you're not going to see the guy that you see at rallies, the it's time to vote, but you'll probably see a little bit more Professor Obama here, really trying to show some of these conservative Democrats how he messages on healthcare that he believes in a successful way.
And choosing the forum here is Brett Baer's show. It's their evening newscast, an hour-long evening newscast. Reaches a very large audience, and you're right, big penetration, particularly in these districts that are so important right now. BARACK-ETOLOGY. President Obama unveils his final 4 picks. This time he filled out both men's and women's brackets. And I got to say, just like the last couple of years, the message to would-be Cinderellas is the audacity of nope. It is number 1s and number 2s in his men's final 4. And this is a guy that, you know, for all we talk about political upsets, he is, I think, very conservative in his college basketball picks.
But I think, isn't that true for most people this year? This is a year to be conservative in your picks. The brackets emerge in such a way that 1s and 2s are more likely
Give
than
me some
not,
Cinderella.
no?
I want a 12 seed going far.
God, always looking for a story. Establishment rejected. That's our final top line today. Colorado caucuses yesterday giving us a little tea leaf reading opportunity here because both the GOP-favored candidate, Jane Norton, and the Democratic incumbent, Michael Bennet, they lose in their caucuses. Now, the primary is months away. These are not at all predictive of who will be the nominees, but it does get to a problem, and Michael Bennet knows it because he tried to quell the furor by launching his first TV ad in this race. He barely mentions that he's a United States Senator.
Right, and the data point 1,500,000 that this is a tough year for incumbents right here with the caucuses. Plenty of time to recover, but you're right. This is not a good sign for any establishment candidate.
And we begin with that ticking clock, the final countdown on the big healthcare debate. We're joined by Democratic Congresswoman from Connecticut, Rosa DeLauro. Congresswoman, thank you for being here. Let's begin.
Delighted to be with you.
Thank you. Let's begin with where we are. It is Wednesday. You guys need to get a bill online for the 72-hour clock to start to get a vote in by Saturday before the president leaves. We still have not seen the price tag on this bill from CBO or actual language. When are we going to see that?
Well, that information is forthcoming. We're told that it will, as we've been asking most days, and they will get us that information, and it will be out there as soon as we get it, and we will pass health care, and we're intending to do that by the end of this weekend.
What has the holdup been? Have you been going back and forth with different drafts, making substantive changes to try to make the numbers work?
No, I mean, the CBO has their list of particulars which they have to adhere to, and clearly what we do want to make sure is that we are keeping in mind the cost of the bill, as well as making sure that we can maintain the affordability quality of that we're able to fill that donut hole for senior citizens. And so this is a historic piece of legislation. We had Social Security, you have Medicare, you now have health care reform. One takes time and effort with this. This is a bill that it will change what health care looks like for the people in this country, and we need to get it right. That's what we're intending to do. That's what the Speaker of the House is intending to do, and we intend to pass it.
Congresswoman, could you imagine a scenario by which you guys would vote on this without having that final price tag from CBO?
No, we must have the report back from CBO, which we will have.
Okay, and let me turn to Dennis Kucinich's announcement this morning. Obviously, he's the first person publicly to switch a position from no in November to yes now. How many more people need to switch their position, do you think, in order for the Speaker to get 216?
Well, look, we are going to get to 216, and I want to...
With how many more people
I wanted
switching?
to say that with Dennis Kucinich, his main interest has always been his constituents and the people of this nation. We are going to get to 216. There isn't any question in my mind about that.
Congresswoman, there's been a lot made about the procedure by which this is going to be passed, the rule deeming. We don't have to get into the specifics of that, but I'm curious, will at the end of the day, will this be an actual vote on health care reform, or will members of Congress be able to say, no, I didn't vote for the Senate bill, I voted just for the rule that enacted it, and I made changes at the same time?
No, we are going to vote on the Senate bill. Don't get hung up on the process kick here. We are going to pass the Senate bill. It will be amended and corrected as we do most bills in this House. Move on to what the substance is of this bill, and that is game-changing for people in this country. It's about having a health care that is affordable. It is about holding insurance companies accountable, where they can now willy-nilly say no to you on insurance, no on a pre-existing condition. If you have insurance, they can tell you are too sick to be able to get insurance. All of that is gone. For women of this country, this is truly they are the main beneficiaries, because women today pay 48% more for their health care than men do. And being a woman is a pre-existing condition, whether it is being a victim of domestic violence being considered a pre-existing condition, cesarean section, or a whole variety of other issues. That is what is important. Further, 45,000 people in this nation die every year because they do not have health insurance. It is the substance of this bill that will be corrected so that people can have health insurance, they can afford it. The insurance companies are accountable for what they have. We've lived in the world of the insurance companies for too long. It's now time to turn those medical decisions over to the people of this nation and their doctors. That's what this bill is about. It's not about process. When my colleagues on the other side of the aisle want to talk process, that means they have no substance and are not concerned about making sure that the people of this great nation have health insurance that they can afford when they get sick.
Congresswoman, I do want to touch on a bit of substance in the bill on the issue of abortion. One of the reasons that the Speaker is looking for some of these Dennis Kucinich type votes to flip from no to yes is because you guys are likely to lose some people who voted yes last time, because the bill in November included that Stupak amendment and that language. Now, Tom Perriello, Democrat from Virginia, yesterday came out and said he deemed the Senate language basically abortion neutral. No federal funds for abortion in that Senate bill. He no longer considers abortion a big issue. Do you envision Stupak coming along to that position? Do you envision you're going to lose some members who just don't believe the Senate bill goes far enough in abortion?
Let me just give you 2 points. We are going to pass the health care bill, and we are going to maintain the current federal policy of no federal funding for abortion. And we are going to pass this bill with that. This is not a bill about abortion. This is about health care, and we will pass it by the end of this weekend.
And we're going to see the bill today?
We are all in the hands of CBO, and we are waiting for their report.
Probably not the most envious position in the world. Congresswoman Rosa DeLauro, Democrat of Connecticut, thanks a lot for being here today.
Thank you.